Maryland announces $94 million to help fight and treat diabetes as well, a serious underlying health condition, as we know, for people who do get COVID. And WJZ is live, Paul Gessler, with how that money will be spent and how the pandemic underlined the severity of the disease locally. Paul.
Denise, more than 2 million Marylanders have diabetes or prediabetes, and it is a major comorbidity to several diseases, including COVID-19.
I'm overcome with emotion because I didn't think I was going to make it.
Healthcare technician Rosa Felipe was discharged last week from a Florida hospital after months in the ICU. Her diabetes among the underlying health conditions contributing to her hospitalization.
Diabetes affects your life in multiple ways, and on top of that, COVID-19 is making it even more complicated.
Dr. Arsalan Sheikh of LifeBridge Health says last week's announcement of $94 million to prevent, educate, and train those to manage diabetes will save lives.
People who have diabetes and develop COVID-19, their risk of complications and mortality dying from diabetes and COVID-19 is much, much higher.
A study this summer of hospitalized COVID patients with uncontrolled diabetes showed a mortality rate of nearly 29%, dying at a rate nearly 5 times higher than those without it. COVID aside, diabetes has been on the rise in Maryland and among younger people. Dr. Sheikh, though, says health disparities among underserved populations run parallel with risk factors for COVID-19 and other diseases.
It is the underserved population. African Americans, Latinos are more likely to get complications or die from COVID-19.
Now, the announcement last week by Governor Hogan also includes $6.6 million from Care First to combat those social and health disparities. We're live at 5:30 tonight. I'm Paul Gessler for WJZ.